In 1811, a renowned English author named Fanny Burney lay on a bed surrounded by 7 men in dark coats. She was about to undergo a mastectomy. She remained entirely awake. She later wrote a letter detailing the horrific crunch of the knife against her breastbone. She felt everything. She survived. This forces a massive question upon us. How did anyone endure the pure agony of the surgeon's blade before the year 1846? The absolute most important factor for survival was speed. A slow surgeon meant a dead patient. You needed someone who could slice through tissue and saw through bone in the blink of an eye. Enter Dr. Robert Liston. He was a towering Scottish surgeon operating in London during the 1830s. Liston was famous for yelling to the operating theater gallery to time him. His record for removing a human leg was 25 seconds. He moved with such frantic urgency that he once accidentally sliced off the fingers of his surgical assistant. The patient died of gangrene later. The assistant suffered the exact same fate. A spectator in the gallery dropped dead from sheer terror. That single operation remains the only surgery in human history with a 300% mortality rate. Still, if you needed a limb removed, Liston was your best chance at surviving the sheer shock of the pain. Beyond pure speed, patients sought chemical relief. The ancient world relied heavily on concoctions of herbs. Mandrake and henbane were highly popular in medieval Europe. By the 18th century, the prescription was usually a massive dose of alcohol. Surgeons would pour pints of whiskey or rum down a patient's throat until they were essentially blacked out. Opium was heavily utilized as well. The problem with these methods was the exact dosage. Give a patient too little rum, and they thrash around violently during a delicate incision. Give them too much opium, and they simply stop breathing forever. There was zero middle ground. The chemical relief was basically a gamble with death itself. When the alcohol failed to numb the body, brute force took over. Hospitals employed massive men specifically to hold people down. These assistants would pin the arms and legs of the screaming patient to a wooden table. Some operating chairs were built with heavy leather straps to bind the chest and limbs tightly. The pain was so unimaginably intense that the human brain often triggered its own extreme defense mechanism. Patients would simply pass out from the agony. Downtime was considered a massive blessing in the operating room. It gave the surgeon a few precious minutes of a perfectly still subject. Desperation breeds strange innovations. In the middle of the 19th century, an incredibly bizarre method gained massive traction in places like India and Europe. It was called mesmerism. Dr. James Asdale, a Scottish surgeon working in Bengal, claimed to have performed hundreds of major surgeries using only hypnosis. He would spend hours waving his hands over the patient, placing them into a deep trance. According to his extensive medical records, tumors were removed or legs were amputated. The medical establishment mocked Asdale relentlessly. They accused his patients of faking it. We now know that deep hypnosis can alter pain perception, making Asdale an accidental pioneer of psychological pain management. We rarely consider the psychological burden placed on the men wielding the scalpel. Hearing a fellow human beg for mercy while you cut into their flesh requires a terrifying level of detachment. The legendary 18th century surgeon William Cheladin was known to vomit from severe anxiety before entering the operating theater. Other doctors wrote diary entries about enduring entirely sleepless nights before a major amputation. To survive the trauma of their own profession, many surgeons became totally emotionally numb. They walked into the room, blocked out the agonizing screams, did the bloody work, and left as quickly as possible. Everything changed on a quiet October morning in 1846 at Massachusetts General Hospital. A dentist named William T.G. Morton administered ether to a man with a tumor on his neck. The surgeon removed the growth. The patient woke up and stated he felt a mere scratch. The era of surgical torture evaporated in that single moment. Looking back at the brutal reality of the centuries prior, we see a raw portrait of human endurance. People survived through a brutal combination of speed, heavy liquor, brute force, and the sheer will to live another day. We walk into modern hospitals with complete faith in a painless sleep, completely removed from the screaming history that built the foundation of modern medicine.